meeting that normally would fall on the Memorial Day holiday, but also for all those who have passed away from and are impacted and ill from the coronavirus. So I'd ask everyone for a moment of silence, please. Thank you. Okay, next up on the agenda, we have public comments. At this time, anyone may address the board on matters which are on the agenda. Please go to the podium, or in this case, raise your hand on Zoom, and state your name and home address. Just if you have something specific on the agenda, we would allow discussion if you're involved in that at that time. But for anyone who would like to speak on something that is on the agenda, contact Dawn Sherman by raising your hand on Zoom. And I'll give a few seconds here for folks to do that. Okay, hearing none, we'll go to item 2 on the agenda, approval of minutes of the meetings, excuse me, of May 11, May 13, May 18, May 20 of 2020.
I will make a motion to approve as presented.
Second.
Motion made and seconded to approve the minutes. Any discussion? All in favor signify by saying aye.
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 Aye, carried 3-0. We have item number 3 is consent items. I don't believe we have any. So we'll move to item number 4. Procurement procedures, a proof of publication.
Motion to approve the proof of publication.
I will second that.
Motion made and seconded to approve the proof of publication in 4A. All in favor signify by saying aye.
Aye.
Aye, carried 3-0. Item 4B, receipt of quotes, fuel for secondary roads. We have, Anthony, would you like to make any comments on this while Dawn and Megan are gonna work on the bids, or the quotes, excuse me?
Yeah, I really don't have much on this. We take yearly quotes on our fuel, so they'll bid on their bid is for above rack average. So it'd be so many cents per gallon above rack average.
Thank you, Anthony. Do we know how many we have? How many quotes? We have 3 quotes.
Okay, so Anthony, should I read it from each of the shops? Do I need to read all of those?
Yeah, because more than likely they'll have different prices for different shops. Even the same vendor will probably vary his prices a little bit.
Okay, so we have the first one from Demer Oil Company for the Dubuque shop, number 2 premium, 0.055 cents. For the number 1 premium, 0.075. And for gasohol, it is 0.0505. For the Farley shop, number 2 premium, 0.055. number 1 premium, 0.075, and the gasohol is 0.0505. For Bernard, number 2 premium, 0.1268. For the number 1, 0.1488. In Fillmore, number 2, it is 0.1268. And for number 1, it is 0.1488. And actually, if it's okay, that is with them all for Bernard, Fillmore, Worthington, New Vienna, Holy Cross, and Durango were the ones that I just stated. Would you like me to read each of those, or is that okay, Megan? Is that okay if they're all the same? Okay.
Anthony, is that satisfactory?
That is, yes. If they're all the same, I'm fine with that.
Okay.
The next bid is from Sanders Oil Company, and they only bid the Dubuque and Farley shops. So for Dubuque, number 2 premium, 0.052. For number 1 premium, 0.062. And for the gasohol, it's 0.0489. And those are the same ones for the Farley shop as well. And they did not bid the other facilities. The last vendor is from Mulgrew Oil and Propane Company. All right, for both the Dubuque and Farley shops, they are the same quotes for both, so I'll read those. Number 2 premium, 0.096. For number 1 premium, 0.096. And for gasohol, 0.071. And that is for both Dubuque and Farley. Right. The next ones for Bernard, Fillmore, and Worthington are all the same, so I'll read those once for Bernard, Fillmore, and Worthington. The number 2 premium, 0.191. The number 1 premium is also 0.191. For New Vienna, number 2 is 0.201. For the number 1 premium is also 0.201. Holy Cross area, the number 2 premium is 0.181, and the number 1 is also 0.181. For Durango, the number 2 premium is 0.171, and that is also for the number 1 premium, 0.171. And those are your 3 bids this evening.
Okay, I'll make a motion to receive the bids and refer to the county engineer for his recommendation.
Second.
Okay, the motion is to receive the bids and refer to county engineer Anthony Bargett for his recommendation. Any discussion? All in favor signify by saying aye.
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 Aye. Carried, 3-0. Moving to item 5 on the agenda. Public hearings. Proof of publication for public hearing.
Make a motion to approve the notice of public hearing.
Second.
Okay, this is the proof of publication for the public hearing. Okay, motion made and seconded. All in favor signify by saying aye.
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 Aye. Carried, 3-0. 5B, public hearing on FY 20 budget amendment number 5. We would refer to our budget director, Stella Rundy.
Good evening, everyone. Can you hear me okay?
We can hear you just
Yes,
fine,
I can.
Stella.
Great, thank you. So we are here to discuss our final budget amendment for FY20. This is amendment number 5, which is quite a few. We've done some here at the end due to COVID, so it's been an extraordinary circumstances for everyone. This is the notice that was published in the newspapers. I'll kind of walk through some of the stuff that is in this budget amendment. We had an additional $200,000 contribution to the Community Foundation of Greater Dubuque for COVID relief efforts. We had a loan that we approved with the city of Rickardsville for $100,000 to help them with their sewer project. We had a new phone system for the DHS office. Roads moved some monies forward to get started on some projects, hopefully in June. So they would start in June and carry forward into our next fiscal year. We had a lightning strike way back when in the fall, and those totals have been updated to the actual cost. We did a loan fund with ECIA for economic development, so that was $200,000 with that loan fund for COVID relief as well. We've also gotten a couple of grants. So we got a Department of Justice grant of $58,008. We had a CDBG grant in our last amendment. We had it in at a higher amount than what we actually received, so I've adjusted that down to the actual. That was $99,282. We increased some general assistance funding for funerals by $25,000. And that's about it. Related to COVID relief efforts again. Of course, this is the last chance that we have to amend our budget for FY20. We can't amend it in the last 30 days of our fiscal year, which would be the month of June. It's hard to believe we're nearing year end, but we are. So I'll leave that open for questions from anyone, or you open the public hearing.
Stella, I have a question.
Sure.
Can you walk us through the balances? And maybe this isn't the time to ask that, and I would recognize the chair if that's so, but the balances of the COVID accounts. So we had some money that we set aside or transferred, assigned to the Board of Health, to technology, to general unrestricted money as well.
I don't have all of that in front of me, so let me see.
Are any of those dollars in this?
They're all in this, meaning that they were approved in previous amendments. So they're in here. Now, they're not all spent, which is the hope that we don't have to spend all of that, but it was appropriated in the event that we needed it. And so all of that is built into here. There was about $2 million of spending for COVID. $2 million.
And we feel good that we have sufficient amount of those funds clearly left, that we don't need to amend this budget number 5, right?
Correct.
Okay.
But all those funds will be unappropriated or not appropriated starting fiscal year 21. So July 1, those funds will go to zero.
Yeah, so I think we need to look at another budget amendment really quick at the start of the year. We did that this year due to our construction of the West Campus. And I think we need to look at that for COVID spending.
Agreed. Thank you.
I will make a motion to open up the public hearing.
I will second that.
Motion made and seconded to open the public hearing. Before we do that, I didn't get to ask my question of Stella, so I'm gonna go in discussion and just ask Stella if we could get, even though we won't be able to change anything, if we could get a report on the additional funds that we've distributed for the COVID pandemic, and that would be the additional funds that we allocated for your budget, for to see if there's a updated report from the Community Foundation of Greater Dubuque, and also from the Board of Health, from the Health Department. I think
Sure.
it would be good for us to at least know where we're at, and just would like to see some kind of an update.
Yes, we have been continuously updating that, so I will get that in a format to get out to the board and have a discussion on that.
Thank you. Okay, all in favor of opening the public hearing signify by saying aye.
Aye.
Aye, carried 3-0. Public hearing is open. If anyone would like to speak, please raise your hand on Zoom, and Dawn Sherman will unmute you. We're in public hearing for the last budget amendment of FY20. No one has raised their hand at this point. We'll give a few more seconds. Nope. Okay. All right. I guess a motion to close the public hearing would be in order.
Motion to close the public hearing.
Motion is made
And I will second that.
and seconded to close the public hearing. All in favor signify by saying aye.
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 Aye. Carried 3-0. So we'll move on to item 5C, adoption of the FY20 budget amendment number 5.
So 5C, the document in front of you would be the document that Dave or the board chair and the county auditor would sign that is submitted to the state. So the motion would be to execute that document and submit to the state.
Make a motion to approve the document and forward it to the state.
I will second that.
Okay. Motion made and seconded to approve and adopt the FY20 budget amendment, number 5. All in favor, is there any discussion? All in favor signify by saying aye.
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 Carried 3-0. Item 5D, the resolution approving the FY20 appropriations amendment number 5.
So this is the resolution that we do for appropriations per department and by fund. So it lists each department and each fund and totals down at the bottom. So we have to approve all of these by resolution, by code.
I'll make a motion to approve resolution for fiscal year 20 appropriations amendment number 5.
Second.
Motion made and seconded. Open for discussion. All in favor signify by saying aye.
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 Carried 3-0. 5E on the agenda, resolution approving FY20 fund transfers amendment number 5.
And then this resolution, of course, is the fund transfer. So any transfers we're doing between any of our internal funds need to be listed separately. And that's what's shown here.
Stella, a question on the long-term capital projects to general basic. Can you explain that one
Sure.
for me? The 600,000?
Yep, so that was for the sheriff's storage building. So we decided to take some funding out of our long-term capital project fund, which has, I believe the next document.
2.2?
Yep, 2.2 million. So we decided to move money into the general basic fund, which is where the capital project was actually occurring, the expenses for the capital project. As we know, that project has not moved forward at this point. So there is that money in general basic at this point, waiting for that project.
Okay, thank you.
Yep.
I'll make a motion to approve the resolution for the fiscal year 20 fund transfers amendment number 5.
Second.
Motion made and seconded to approve the resolution approving FY 20 fund transfers amendment number 5. Open for discussion. All in favor signify by saying aye.
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 Aye, carried 3-0. Okay, item 5F is a notice of public hearing, and it's case number ZC number 05-10-20. Bruce and Vicky D'Agostino, A1 agricultural to A2 agricultural residential. And this is to
Make a
approve the
motion.
notice of public hearing.
Make a motion to approve the notice of public hearing.
And I will second that.
Okay? Motion made and seconded is open for discussion. All in favor signify by saying aye.
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 Aye, carried 3-0. Okay, we have a resolution, excuse me. Next item on the agenda is item number 6, approval of plats. Item 6A, resolution, final plat, Cass Farm subdivision, section 29, Table Mound Township. We have Tammy Henry on?
Yep. Yeah, I'm here. Can you hear me?
Yes, we can,
Yes.
Tammy.
All right. So this property is owned by Bonnie Cass, and it's located 2.57 miles southwest of the city of Dubuque along U.S. Highway 151, with a total of 25.45 acres surveyed. The property is zoned A1 agricultural, and the purpose of this plat is to sell Lot 1 to a son for agricultural purposes. The survey creates 2 lots. Lot 1 is a total of 12.56 acres surveyed, and it will be sold to the son, and it will remain in current agricultural use. Lot 2 is a total of 12.89 acres surveyed, and it will remain in current ownership and agricultural use. Lot 1 will use an existing field entrance off of Nolan Lane, and Lot 2 will use an existing residential entrance off of U.S. Highway 151. There were no additions or corrections required for this plat, and there are no liens or mortgages on this property, and all the signatures are current. This plat has been reviewed by myself as the plats officer and has all the required signatures. I respectfully recommend approval. I know that Dave Schneider is on, as well as Bonnie Cass. I think they would like to have some, Dave wants to explain it, I guess.
Okay, Dave Schneider, I believe you're unmuted. Are we having trouble finding him?
All right, there you go. Now I think I'm unmuted.
All right, Dave, go ahead.
All right, yeah, just basically, Bonnie's son is looking to purchase a portion of the farm, start working his way into it. And she's obviously interested in transitioning out of her ownership into her, son, and into keeping it in the family. And basically, a way to get him started, start building some equity, and kind of get things rolling. So it's pretty straightforward. It's already been divided by the highway. We're just basically providing descriptions for the parcels that are on each side of Highway 151 down there in the Ryan Road area, south of Dubuque. And would be happy to answer any of the questions you have related to it.
Do we have any questions for Dave Schneider?
I do not.
I do not. I'll make a motion to approve the final plat.
I will second that.
Okay, motion made and seconded to approve the final plat. Is there any further discussion? All in favor signify by saying aye.
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 Aye, carried 3-0. The final plat is approved.
Thank you.
Thank you, everybody.
Thank you. We're moving to item 7 on the agenda, action items. The board may approve, deny, or table any action item. 7A is a resolution, appointment of deputies, assistants, and clerks.
This is a position filling a current vacancy, so there's no added FTEs to the Sheriff's Department, so I recommend approval.
I'll make a motion to approve the resolution.
Second?
Motion made and seconded to approve the resolution in 7A. Any further discussion? All in favor signify by saying aye.
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 Aye, carried 3-0. 7B, resolution approving the contract with RTA for transportation services for Sunnycrest Manor. Chris Kirsch, I believe you're unmuted if you want to talk, speak on this.
This contract is unchanged from last year. We use RTA mostly for programming in our ICF ID. They take our residents to ARC and to adult daycare. So I would respectfully request that we sign this, although we're not using RTA at this time. We hope to in the near future.
I'll make a motion to approve the resolution approving the contract with RTA.
And I will second that.
Motion made and seconded to approve the resolution approving the contract with RTA for transportation services for Sunnycrest Manor. Is there any further discussion? All in favor signify by saying aye.
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 Aye, carried 3-0.
Thank
Item
you.
7C, resolution approving the Dubuque County Fund Balance Special Project Request for psychiatric nursing services for the county jail. We have May and Jody are, I believe, unmuted.
Hello, it's Jody. How's everyone tonight?
Hi, Jody.
Hi. Yes, this was presented last month at the Regional Governing Board, and at that time, Dubuque County requested that the region paid for it from our regional funds. However, the motion was not carried, and so we are proposing that we go back and ask the Regional Governing Board at the meeting Thursday to approve it as a fund balance project using Dubuque County fund balance dollars. We've discussed this before. It's for psychiatric care. The RN is from Hillcrest. They would collaborate with the primary care nurse from Advanced Correctional Health Care, who is the provider in the jail. They would do suicide assessment and provide suicide monitoring, crisis response, and one-on-one psychiatric support, and then link up to follow-up psychiatric care after discharge from the jail. The request is for $19,865. So I would ask that the Board of Supervisors would approve this, and we can take it to the Regional Governing Board Thursday.
This is Dave Baker. One of the, when I presented this as a project to be funded by the region, one of the criticisms was that what are you going to get done with 10 hours a week, indicating perhaps that we were undershooting. Now, it didn't get any traction there. I think it's a worthwhile program. We've heard from Sheriff Kennedy and Mike Menster, our Captain Menster, that this is a recommended service. So I definitely would support this.
Hello, Chairman Baker. This is May. May, I realize that was a question at the April Governing Board meeting, but I think that we need to get not caught up on that. When we submit fund balance projects to the region has an assumption that the local county has determined that the need is there and that the level that they're requesting fits that need. Now, I understand, and I can't remember who asked you that question, but maybe one of the larger counties, maybe it was a supervisor from one of the larger counties where they have a greater need and they don't feel like they could have gotten their support with 10 hours a week. But I know that Sheriff Kennedy and Francie Tischer from Hillcrest have worked to make sure that they identified the need and they developed a program that they think will fit that need.
I make a motion to approve the resolution.
I will second that.
Motion made and seconded to approve the resolution. Is there any further discussion? All in favor signify by saying aye.
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 Aye, carried 3-0. Okay, next up, under item 7, action item 7D, a resolution approving the collective bargaining tentative agreement with AFSCME Local 2843. This is our bargaining unit at Sunnycrest Manor. And I guess I would defer to Dawn Sherman and Chris Kirsch.
Thank you, Chair. We were able to come to an agreement, a tentative agreement with this bargaining unit, actually prior to COVID, but we wanted to ensure if there are any changes and did not know where COVID would take us. But this one includes some pay adjustments. The Sunnycrest employees are on our lowest wage scales in the county. And there has been some retention and recruitment issues. And so we believe that these wage adjustments that will go into effect July 1st will help with those issues for Chris and her team. And then this is a 3-year agreement. And so we have agreed to a 3% wage increase for years 2 and 3. We did add Martin Luther King, which we have already given that holiday to them as well. I was happy to see that we continue to support that. So those were the major changes in this. As you can see, these are our essential workers. They've really stepped up and improved that, and so I'm happy to present this to you as a tentative agreement with that bargaining unit.
Thank you, Dawn. Chris, any comments? Chris Kirsch?
Dawn?
I don't have any further comments. I again request that you support this.
Okay. Questions for Dawn or Chris? There's
the resolution. So the resolution, I didn't see it in my packet, so I was looking for that. So thank you.
I think it's important to note for the community that this is does contain wage increases and also 3% wage increases for some categories, and that while that may seem out of step with the circumstances that we find ourselves in today with regard to the COVID and the devastating effects on the economy, citizens need to also understand that we have recruitment issues. There's such need for nursing, the CNAs, nursing care, positions of every kind at Sunnycrest that we can't let the community down by not moving forward with this increases that they really were negotiated prior to COVID. And I support these increases personally. So I would make a motion that we approve the resolution and finalize the collective bargaining agreement.
And I will second that.
Motion made and seconded to approve the resolution, thereby finalizing the collective bargaining agreement with AFSCME Local 2843 for the bargaining unit employees at Sunnycrest Manor. Is there any further discussion? All in favor signify by saying aye.
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 Carried 3-0. Item 7E, a resolution, approve amended FY20 secondary road budget. Anthony Bargett.
Yeah, so based on the numbers that Stella and the explanation that she gave earlier, we're taking those numbers and putting it into this format for the DOT that we have to submit to them. So this is required by the Iowa DOT by our department.
Okay, thank you, Anthony.
I'll make a motion to approve the resolution.
Second the motion.
Motion made and seconded to approve the resolution. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. We're moving to item 8 on the agenda, communications. This is correspondence that the board will receive and file without taking action. Item 8A is a manure management plan, annual update, Circle Ridge Holsteins. Item B.
I'll make a motion.
Okay, go ahead, Ann. Sorry.
I'll make a motion on the first, which is to receive and file the communication, which is a manure management plan update.
Thank you.
I will second that.
Motion made and seconded to receive and file. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. 8B, City of Piasta, annexation notice.
I guess I would just like to make a comment here, which is that some of the parties to the contracts, Birds and McDonough, have family relationships. So I normally would, or previous family relationship, I normally would not vote on this. But in this case, all we're doing is filing voluntary annexation documents. And so to that end, I would make a motion to receive and file the notice of voluntary annexation.
And I will second that.
Motion made and seconded to receive and file the City of Piasta annexation notice. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Item 9 on the agenda, 9A, appointments, and 9B is open vacancies. No appointments in 9A, and for informational purposes, the open vacancies in 9B. Okay, moving on. Item 10, personnel requisitions. We have an administrative assistant for CEO, MHDS region. And we'll go to Dawn or May, or May on this.
This one was discussed, May did present this during the budget. It was to add some additional administrative support. Her plan is to have this, this position utilize current space down at our Creative Adventures Lab where our social workers are there, so we would not be needing any additional space. But I can allow, if May would like to just speak about what this position, the need for this position, but it is budgeted. It was discussed during her budget presentation.
Thank you, Dawn. This is May Hinchin. This position, previously in the region, the administrative assistant duties were split, if you will, between Lucia Herman, who is the coordinator in Jones County, and she does the minutes and the agendas for the regional governing board meeting, and Christy Clark, who was the former coordinator in Lynn County. And Christy's title wasn't necessarily coordinator. I can't remember what her title was, but she was more like an assistant to the former CEO. And shortly after I took the position, Christy resigned. Well, she had planned to resign before I took the position, so I think it wasn't because of me. But Christy had her resignation plan before I started, so she's moved on to bigger and better things. And just doing some reshuffling of staff responsibilities. Lucia Herman in Jones County is a really good and talented social worker. And I would like to use her skills more as a social worker than as an administrative assistant in doing the minutes and whatnot for the regional governing board meetings. So I had approached to the regional governing board that we could hire a part-time administrative assistant in order to free up Lucia's time so that she could do the social work activities that I would like her to do. She's actually going to be our children's coordinator at the beginning of July. And then in Lynn County, we hired a full-time coordinator whose job is not to be my assistant. So anyway, the regional governing board had approved this. So we, just because of my employment is through Dubuque County, and it was my request, I'd like to run this through Dubuque County as well, but this will be 100% reimbursed by the region.
May Ann McDonough with a question. Do you anticipate that this person will also be hired and be located in Dubuque County? Yes?
Yes, yes. I would like the person to be hired and located in Dubuque County. When you say located, Supervisor McDonough, I'm assuming you mean office in Dubuque County.
Correct.
Okay. I would like on the advertisement for this position to state something like that we will give preference to applicants who live in the 9-county region. I won't, if that's okay with you, I would not require that they live in Dubuque County, but I'm not sure what your policy is since the Dubuque County will be the employer of record. So I need your advice on that.
There is no residency requirement, either administrative policy or a state code. There's no residency requirement.
Okay.
Cities of over 15,000 can have a residency requirement. I believe that's the case. I don't believe counties have residency requirements, and I don't believe they can have that.
Okay. So thank you for that. As Dawn mentioned, I would like to office the person in the second office that we lease at the Innovation Lab. There's plenty of space in that office for the regional social worker who's, well, pre-COVID, who was there about 1 day a week. And you see that this is a part-time position, so there's plenty of space and availability in that other office that we're already paying for down at Innovation Lab. So that's why I'd like the new administrative assistant to be there. So yes, office in Dubuque County.
I'll make a motion to approve the personnel requisition.
I'll second it, but I'd like some discussion.
Motion made and seconded. We're open for discussion.
May, is this, you may have mentioned it, but is this a net add to the overall regional budget?
Yes.
Okay. And when did the region approve this?
Oh, I believe it was our January meeting, Supervisor Wickham.
Okay. So prior to the pandemic. At this point, I would like to go back to the region and get their approval. Things have changed in all of the counties and their budgets, and all not to the better related to our budgets. And so I think it'd be prudent to make sure the region is fully supportive of this expenditure before we approve it.
The regional governing board, and I hear your point, but the regional governing board did approve this in the budget at the April meeting.
Do you know the date of that meeting? Was it the end of the April or beginning of April?
April 17th.
17th, right in the middle. And from your understanding of that meeting, the meeting notes, there was no hesitancy related to adding additional staff and costs?
Correct. One of the things, you bring up a very good concern, but one of the things that I did with the reassigning of some of the duties with coordinators is I actually was able to prevent adding another coordinator. So coordinator salaries are a lot higher than a part-time administrative assistant. And when I shifted things around and took the administrative assistant duties away from Lucia in Jones County, it allowed me to assign her the children's coordinator position so I didn't have to add a new coordinator. So yes, this is a net add, but when you consider the fact that I would have by code have had to add a children's coordinator, I was able to prevent that.
I appreciate that clarification, but you kind of lost me. I'll have to admit. So, you know, so I guess what I'd say is, you know, is the budget, you know, all things being equal, is the budget in fiscal year 21 going up because of this position? If there's other positions that are eliminated or replacement and the whole dollar amount's the same, I'd be interested in hearing it. But if it is a true net add of whatever the employee wage plus benefits in the, you know, 40 grand range are, that's my question. So is it, do you believe today it is a net add of that 40-some thousand?
In our personnel line item, yes, but our net add in our entire regional budget is far greater than this.
It also, if I might just, it's my understanding as a supervisor who would have been involved in this, is that by having the children's coordinator, which could be an $80,000, a $90,000, a $100,000 position filled with a coordinator, this is going to result in a net savings to the region. Other regions are having to hire a separate children's coordinator. So I think, you know, we're hiring part-time to fill the need that we have, but other regions are hiring differently because that position is required. Supervisor Wickham, that's in the code that we have to hire a children's coordinator.
Maybe one of my last question, May, when is the next regional board meeting?
Thursday.
This Thursday?
Right.
Yeah, I would recommend we bring it back to that regional board one more time. That would be my request. If it's just this Thursday, I think we could easily then address this at our next meeting, which would be Monday, the following Monday.
It isn't an item on the agenda, as far as I know, for the regional governing board. So it would result in a delay. But I think, you know, my support for this, being a member of the regional governing board, is to approve this. This was something that's been discussed at the regional level for many months.
Any other discussion? And just in comments, discussion, I'm inclined to support this. This is an assignment of Supervisor McDonough, and her recommendation carries weight with me in my decision, and also hearing the explanation from May Hinchin. So I'm prepared to support it. Is there any other discussion? All in favor signify by saying aye.
Aye.
Aye. Any opposed?
Nay.
Carried 2-1.
Thank you.
Okay, we're moving on in the agenda. Item 11, tabled and pending items. Don't believe we have any, so we're going to move to item 12. Public comments at this time. Anyone may address the board on matters of which are of concern to that person, which are not agenda items. Please go to the podium, or in this case, raise your hand on Zoom. State your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. So if you would like to speak on something that is not on the agenda, please raise your hand on Zoom. Okay. RRS, you're unmuted.
Yes, hi, RRS Stewart, Dubuque County Historic Preservation Commission. I apologize for missing the meeting 2 weeks ago where this came up. But I was just letting you know I was here because I know the annual certified local government report was tabled. So if you have any questions about that you want to bring up, I'm here and I'm available.
Okay,
RRS, just to let you know, is kind of clerical in nature. I attempted to get that placed back on this agenda today, and apparently the agenda was issued before I made that request. So I think it'll be handled shortly.
Okay, that's fine.
we can get this on as soon as next Monday.
Okay, well, I mean, whatever works for you all. I just wanted to let you know I was here for whenever that comes up.
Okay, thank you, RRS. Are there any other comments under public comments? Okay, hearing none, I would entertain a motion to recess as we have another meeting scheduled immediately following this meeting. We actually don't have to stop if my counterparts are okay with that, but if we'd like a brief break, we can do that.
I'm fine, whatever the
I'm
chair's
fine.
discretion.
Okay, I think a motion to recess this meeting would be in order.
I'll make a motion to recess for 5 minutes.
Okay, motion to recess for 5 minutes.
Second?
All in favor signify by saying aye.
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 Carried 3-0. We'll take a brief 5-minute recess. Yep. Okay. I'm staying right here, so. So, I'm gonna shut this off. There's a, Okay, we'll convene the work session, joint meeting with the Board of Health. First item is update from the county emergency response team on COVID-19. We would normally go to Patrice Lambert for her report, so I'll turn it over to Patrice.
Hey, thank you. And Tom Berger and I were just in a meeting with the county firefighters and EMS. So I was able to present first on the agenda, but I don't know if Tom will be able to join us later or not. A lot of the update I'm going to save until the Board of Health agenda, but I will state that I just encourage people, if you're not on the listserv with Randy Gale for the Dubuque County Public Health Incident Management Team updates on a daily basis, please do so. I just want to read just a short section of today regarding the testing, which we will cover in more detail once we open up the Board of Health meeting. But as of 2 p.m. today, 135,280 Iowans have been tested, including 4,850 Dubuque County residents. Iowa has a positive test rate of 13.1%, while Dubuque County is at 6.7%. 1 in 20 Dubuque County residents have been tested, and 1 in 23 Iowans have been tested. So I'll cover more of our testing once we open up the Board of Health, but I just encourage people, if you're not on this listserv from Randy Gale's daily update, to please do so. The only other item and it'll probably be covered in more detail as well with the Board of Health, is the Test Iowa. Now that everyone is eligible to be tested through Test Iowa, please, we just encourage people to continue to go to that site. If you've done it in the past, but you have not done it since this past Friday, I have done it myself, and I am eligible, and there is a section that states that if I wish to wait until another site opens up closer, that I can do that. So we're hoping still to get a Test Iowa in Dubuque County. So again, please, if you wish to be tested, and if you have not taken the Test Iowa survey since Friday afternoon, please get on it and take it, because everyone, the governor had reported everyone is eligible for the testing now. So that's the only update that I have right now until we get into the Board of Health agenda.
Patrice, Ann McDonough, can I ask you, if a person doesn't have symptoms and they're staying home, is there any reason you should get tested?
No, only out of curiosity probably, but no, you're absolutely correct. If you're staying at home, you don't have any of the symptoms, you haven't been in contact with anyone, you have implemented the mitigation strategies, there's probably no reason. But even if you have gone out to a grocery store and you have been just even close to someone who has not worn a mask, or if you have not worn a mask, it would just be a good, again, snapshot for us to see in Dubuque County who is actually testing positive. But if you have not ventured out at all, and if you've been homebound, have no symptoms, then no, there would not be a reason, Ann, in my eyes. Anyway.
Right. And we have our positive rate of just 6%. That's good news.
Correct.
Patrice, Dave Baker, would an exception to that be if, let's just say hypothetically, a grandchild was on vacation in the Lake of the Ozarks and came back and wanted to visit Grandma? Would Grandma then want to get tested?
Absolutely, but I'm just saying if you're homebound with no one around you and you're not showing the symptoms. But once you have been exposed to someone, if they're not following the mitigation strategies or having a mask on, whether it be you or another person, then yes, I would say to get tested. But if you're homebound all by yourself, have no symptoms, then no.
Okay. Other questions for Patrice? All right. Do we have Tom Berger on the call? Tom might be covering another meeting.
And I think that meeting days goes until about 7 or so he may join.
Okay. All right. Now we will go to item 2 on the agenda, which is the Board of Health update. And I will virtually turn the gavel over to Chair Tom Beschen of the Dubuque County Board of Health.
Thank you, Chair Baker. I hope my computer continues to work. I was just bounced out of Zoom 3 times in the last 5 minutes, so let's keep our fingers crossed. So we do have a quorum from the Board of Health. We have Susie Stroud, Diane Heiken, Todd Lang, Diane Pape-Freiberger, and Dr. Bobby Konaru on the line, as well as myself. So we have 6 members from the Board of Health. We do have 4 items on our agenda, and following those items, we will have time for public comment. So the first item I'd like to address is COVID-19 testing, and Patrice has already given somewhat of an update, but I would turn it over to Diane Pape-Freiberger for any additional comments. Diane?
Sorry, I forgot to unmute. I would like Patrice to go ahead and give her update on the COVID-19 testing and the initiative that they are currently undergoing. Her and I have had email exchange this morning, and my report would follow what Patrice has to say, if that's okay with her.
Absolutely. This is Patrice, and I know we do have Stacy Killian on. Stacy will provide all of the numbers, but all of last week, we again were able to get from the Iowa Department of Public Health collection kits and the testing process at no cost, and we concentrated for the whole week on the categories of assisted living staff, residential home staff, the contact tracing, law enforcement, and then we did invite special populations such as food pantry workers, the rescue mission, the Elm Street staff to be tested. And Stacy and her staff down at the Visiting Nurse Association actually set up a drive-through testing. So with that, I'm going to turn it over to Stacy because they did a phenomenal job. So I will let her share that information. Stacy, are you on?
Is she muted?
Stacy does not have audio. If she has a phone number, could she chat in the last 3 digits?
Hi, can everybody hear me?
Yes.
Yes.
Sorry about that. Thank you, Patrice. Like Patrice said, we did a drive-through testing site at our location at 660 Iowa Street last week. We also provided some test kits off-site to facilities that were able to do their own testing. In total, we tested 886 people last week. 602 of them were tested at BNA, and 284 were tested off-site. So I think collaboratively we did a pretty good job at getting as many people as possible. We have started to receive some of our results. On our off-site locations, we're still waiting for final numbers. With BNA, we've received 366 results, which is a little over 60%, and we have had 5 positive cases. So a little over 1% of what we've received back so far has been positive.
Stacy, this is Diane Pape-Freiberger. I have a question. A friend of mine's husband had tested positive through his local provider, and he got the results back in 2 days. Actually, it was a nasopharyngeal test that they did. He ended up with a bloody nose. So when she was pretty scared to come down with contact tracing to your office, not knowing what they were going to do. But with the, she was tested on Thursday through that initiative of contact tracing last week. She has not heard back yet. And she does work in home health care. And she had worked the day that she tested, and her employer keeps pushing, well, don't you know the answer yet, what is the time frame? I assume that with that 2-day turnaround for her husband, that the sample was sent to Mayo Clinic for that quick of a response. Is it usually taking this long for results to come back?
So this is the first time we've tested, obviously, and as part of the contracts that they have with Iowa Department of Public Health, they're contracted with LabCorp to do the testing. We were told on average 48 to 72 hours. I have noted we worked all weekend long. As soon as the result came in, we started making those calls and have been able to maintain and keep up with that. I have noted it's probably taking more along the lines of 96 hours to the 78 at the highest, but some are coming in quicker, but typically it's taking about an extra day. And I don't know if it's because there's multiple places utilizing LabCorp throughout the state, if that's what the backup is. I know LabCorp came every evening at the end of our clinic and couried our results back to their lab. And had just told us the average of 48 to 72 hours, but we are noting it as a little longer. It's certainly not on our end. As soon as the results come in, we're making those calls, positive and negative. It just seems to be taking a little bit longer in the lab than what was expected.
Well, and I know that the governor said today in her conference that they had a record number of testing on Sunday, almost 5,000 on Sunday. So I'm wondering if that didn't delay some of this. But you would have thought that somebody that was sampled on Thursday, they could have been through the system and out of there before Sunday.
Sure.
That was just a question and a concern. This is from people in the public that know that they could get a quicker turnaround time by going different routes versus the route through State Hygienic Lab or LabCorp. Even though to them, it doesn't matter if it's free or not, in their heads, because what they want is they want to know the results so that they can move forward. And when you have an employer with home health care that is awful concerned, at this point, like, how do we move forward without knowing if they're positive or negative? So,
sure.
Thank you
for
this. Yeah, and thank you for the effort. I know that it's not on your end. It's just a concern that it's happening to anyone, that time frame is occurring.
Sure. Thanks, Diane.
And then we have also submitted, the incident management team has submitted a request to the Iowa Department of Public Health to continue on with our testing. We're looking at the first 2 weeks of June, but we have not gotten the approval as of yet. but I will share that our targeted groups that we are looking at are the daycare providers and the children in those daycare facilities, and then contact tracing as well. And then we did request for the long-term care, the assisted living, and the residential homes to test the residents. So we're just awaiting word. Again, we're hoping that we will get the collection kits and the testing process, again, at no cost. But the incident management team are willing to coordinate all of those efforts. And I do know that the governor had, I only listened to just a little bit of it, but I did hear her say with the Dubuque partnering. So I'm hoping that that was good news and that they will continue to partner with us so we can continue doing our testing. And if we are granted, we would again look at 2 weeks to do all of that testing. So once we know, we can let everyone know on that.
Patrice, this is Tom Beschen. Do you have any, what kind of quantities have you asked for?
With the daycare children, the daycare providers and the children, we had requested 1,500. And then with the long-term care, the assisted living residential residents, we had said that the number would be determined as soon as we got the approval. Because then if we knew that it was a go, then we would contact all of those facilities to ask how many residents that they wish to have tested.
Okay.
And Patrice, this is Diane Pate Freiberger. Would that also be offered to those 3 facilities that originally had said that they didn't want to test their staff?
Yes, we would offer it to everyone if we got the approval. Again, though, it would not be mandated. It would be up to each of those sites.
Thank you.
This is Diane Bacon. Would the contact tracing be done at the VNA again?
We have not fully discussed that, but we are hoping so. I'll just say that because it worked very, very well. But we have not gone into any of those specifics until we get the approval.
Okay, thanks. Well, because I guess what I was wondering, I'm assuming the residents would have been done in the facilities. I just wondered how you would do the daycare providers and children. But it sounds like you don't have that, all the details ironed out yet.
Correct. Yep. But once we hear, and we're again hoping that we do get that approval, that's what the rest of the week would be. We would all be doing that.
Okay, thank you.
Patrice, this is Diane Pate Freiberger. I have one more question, and it may be opening a can of worms, but have you heard back from Test Iowa?
I have not, but I was included in an email. I don't know how to answer this. That the governor's office was reaching out to see if Dubuque County would like to do a partnership, but it was not directed toward me. So Diane, I really can't say. I just know that the governor's office did reach out, but I do not know what that conversation was. And I would hate to speak on behalf of the person that the governor's office reached out to.
Well, Chair Beschen, if it please the chair, I would like to speak on this. This is Dave Baker.
Okay, Dave.
Okay. Just so it's not a mystery, there was an email sent later Friday from the governor's office to Mayor Roy Buell and myself asking whether we would be interested in a Dubuque County partnership with the state to regarding Test Iowa. I think with the goal of bringing a Test Iowa site to Dubuque County. And I have responded in the affirmative as chair And I also received a copy of an affirmative response from Mayor Buell of the city of Dubuque. And I just checked and updated my emails, and I haven't heard back. From Paige was the person's name, and definitely am interested in that. So we have the two people that she communicated with are both interested in discussing a partnership, and I have copied. I have copied, I believe, Dawn Sherman, Ed Raber, Patrice. I think I copied you, and Tom Berger in as well, and possibly a few others. So the cat's out of the bag. It was me, and I did indicate that we were interested in having the discussion.
Thank you, Dave. I didn't mean to put you on the spot, but thank you for the update.
No problem.
Thank you, Dave.
Chair Beschen, this is Supervisor Wickham. Would the Board of Health be interested in weighing in a position on that, a motion in support of having Test Iowa come here or something along those lines? I'd be interested in that discussion. So I think it's a great idea, but I think it'd be more appropriate if the Board of Health had an opinion on it, in addition to Supervisor Baker.
I guess I'd open up to the Board of Health to weigh in on that, but I don't see any reason not to support it. What do the other Board of Health members think? Hello?
Tom, go ahead, Bobby, go ahead.
Yeah, this is Bobby Canero. I would definitely support that motion.
Okay.
This is Todd Lang, and I'd be in favor of it.
Okay. Let's see, we have Susie Stroud on the line too.
Yeah, I'd be in favor.
Okay. Well, then I guess I would entertain a motion that would support establishing a Test Iowa site in Dubuque County if that's what's being offered by the state. Would someone like to make that motion?
I guess I'm confused at what the motion, are we making a statement? Is it going to be a written something? Are we emailing somebody? I don't understand.
We are making a motion to provide support for a Test Iowa site when Dave Baker and Mayor Buell discuss it with the governor's office. They can go forward with their discussions with the support of the Dubuque County Board of Health.
And this is just Supervisor Wickham, generally procedurally, not to say that I'm an expert in this. No one supervisor can dictate or mandate anything, nor can one Board of Health member do that. So the governing bodies are quorums, and so that's what I'm interested in is the governing body of Board of Health, which is by state code has power, is to authorize that, so it has some official weight behind it.
Susie, this is Diane Heiken, and we've done this in the past on other issues as a board. And once we move that forward, then Tom Beschen usually does write a letter and send it to the appropriate person. So is that what you would be doing, Tom?
I would document to Mayor Buell and Dave Baker that the Board of Health does support establishing a Test Iowa site in Dubuque County, that we favor that. Yes.
I would direct that to the governor or the Iowa Department of Public Health or Test Iowa. That's who we need to lure. I think we got Buell and Baker on the line.
Yeah.
How about we direct it to all of them?
At this point, this is Supervisor Baker. the communication was sent out to Mayor Buell and myself as chair of the Board of Supervisors to have a discussion about a possible partnership. I think knowing that the Board of Health would support a possible partnership would be nice, but Supervisor Wickham is absolutely correct. I would need to bring this back to, I believe, bring it back to the Board of Supervisors and the Board of Health for their blessing, their vote, their approval. So this is, at this point, it's only been a one-way communication. They've offered to do a partnership. Mayor Buell and I have responded, and we have not reconnected at this point. So I think I don't have any terms, what the partnership would look like, what it would, involve, and those are the things that would need to come back. We don't have enough information, I don't think, to take any formal steps at this point, but I fully agree with my counterpart, Supervisor Wickham, that this would need to come back to the board, both the Board of Health and the Board of Supervisors. So any supportive action or statement would be great, but it should always, be subject to, it would be subject to your approval and the Board of Supervisors.
Okay. So what I hear you saying then, Supervisor Baker, is that a motion at this juncture would be premature until we know a little more about this partnership.
I think that's correct, Chair Beshen, and what we do, the Board of Supervisors will do in cases like this is establish a consensus, that moving forward, having this discussion sounds like a good thing. And then when it becomes a little more formal, we have some details, we bring it back. And other than this week, we're meeting twice a week, so we should be able to do a fairly quick turnaround on it, depending on when the folks from the state get back to us.
Okay. So what I'm hearing from the discussion with the Board of Health is that we have that consensus. I've heard from Susie, I've heard from Dr. Bobby Conaroo, Diane Heiken, Diane Pape-Freiberger. Do you favor this?
Yes.
Okay. So, and Todd Lang has favored it. So you have 6 of 6 favoring this. So I guess we'll move forward stating that there's a consensus with the Board of Health.
Okay, thank you for that.
This is Supervisor Wickham. I think it's wonderful that we have consensus. Generally, what governments want and what elected officials want is very strong clarity. And just a simple letter stating that you would support a test Iowa site in Dubuque to the state would give them that clarity. Not everyone has said good things about Test Iowa. Black Hawk County, one of their elected officials, flamed Test Iowa and called it a $20-some million something. And so I think at this time, and if you're all gathered, what we have is the ability of, we have motions, we have resolutions, we have ordinances. And being able to be at the basic level of that and then possibly forwarding a letter or the meeting notes would send a strong signal to the state that we would welcome that. And I just don't see any advantage in waiting.
I guess I just don't see, sorry, I don't know who I stepped on. This is Susie. I guess in making a motion in a partnership, I want to know who's all involved, and we don't know that. Having a consensus of being that we would move forward, I think is enough, because we don't have any details like Supervisor Baker said. That's my opinion.
And this is Diane Pape-Freiberger. Thank you, Susie, for that comment. My support would be to write the letter to the governor, to IDPH, to Mayor Buell and to Dave Baker and the other Board of Supervisors and the City Council, that as a Board of Health, we support them in this to further their discussions in having Test Iowa come to Dubuque. If anything, just so we could use their algorithm. I think that the system has succeeded in getting people tested and having the staff to do that, which they would support with Test Iowa also. But I think that Dubuque County has that availability currently. But I would totally support a letter of support for that conversation to occur, because I think that maybe we're being in this discussion now because Patrice and the incident command team has requested more collection kits, has asked for Test Iowa to come to Dubuque. And I think that just to support their, reaching out to Dubuque County at this point, I think could be supported with just a simple letter by the Board of Health. Okay, I guess I could read it, or I could offer a motion is for the Dubuque County Board of Health to write a letter of support to the governor, to Iowa Department of Public Health, to the Dubuque County Board of Supervisors, to the Mayor of Dubuque, and to the City Council of Dubuque, to that we support further discussion regarding Test Iowa coming to Dubuque County.
Okay, we have a motion.
This is Todd Lang, and I second the motion.
Thank you, Todd. Any discussion? All in favor? Susie Stroud?
I'm going to say no just because I want to wait and see what this partnership is.
Diane Heiken?
Aye.
Todd Lang?
Aye.
Tom Beshin? I'm going to say nay because of the same reason that Susie stated. Diane Pape Freiberger?
Aye.
Dr. Konaru?
Aye.
Motion carried, 4-2. We will draft a letter and address it to the governor, IDPH, the Board of Supervisors, and the Dubuque City Council.
And the mayor.
Well, he's a part of the council.
Okay.
Okay, all right. Any other discussion on testing? The next item is long-term care guidance. Patrice and Stacy, I would ask you to share with us.
Sure, I'll start. This is Patrice, and after our meeting last Wednesday, on Thursday, Stacy and I did reach out to the Iowa Department of Public Health, the Department of Inspection and Appeals, and Linn County Public Health. And I did share with you our findings from all of that, so I'll just briefly explain that what we had asked was, what is the role of the local public health with the long-term care? And our response was the role of the local public health with the long-term care is to provide guidance on the best practices for preventing the spread of the coronavirus. Our second main question was, does local public health board of health have the authority to mandate compliance within a facility? The response was that the local health department board of health does not have that authority to mandate compliance within the facility, but is a resource to the facility to provide support and guidance during these times. Our third question was, further, do we have the authority to go on site and inspect, and is that expected? Who oversees the long-term care? If a complaint is made, who do they contact? And the response was that it's the Department of Inspection and Appeals is the oversight and the regulatory entity for the long-term care facilities. And the fourth question was, is there a chain of command when family members have concerns over the local or over the long-term care? If so, can you provide, so we can in turn provide a written list to the Board of Health Board of Supervisors? And the response was that each long-term care facility should have a policy and a procedure for family members to address concerns and issues. And if they have followed the facility procedures and they're still unsatisfied, they should file a complaint with the Department of Inspection and Appeals. And those complaints to the Department of Inspection and Appeals, there's actually a phone, fax, and online format to submit a complaint, and the individuals can remain anonymous. And then also, I just wanted to add that Stacy has and will continue to work closely with IDPH to give recommended guidance on facility layout, isolation planning, staffing contingencies, and training. Stacy will also continue her daily contact, reviewing the status of all positive residents until the positive resident is 14 days out of the positive diagnosis. And the state of Iowa listserv of nurses in the area that are willing to work has been given to the facility that has the current outbreak. I did, before I turn it over to Stacy to give more detailed information of her daily conversations with a long-term care facility that has the outbreak, I just wanted to reflect that I have shared with CJ, our county attorney, to get his input on this. And I know that IDPH did provide me with a code, I believe it's a code, or recommendations, but anyway, I sent that on to CJ as well for his interpretation. Just so that you know, Stacy and I are willing to do whatever legally we can, but I am just awaiting to hear from CJ. Unless any of the Board of Health members have heard from CJ, please do share. But before we discuss that issue, I think I'll just turn it briefly over to Stacy so she can give you more detailed information of the daily contact that she has.
Thanks, Patrice. I actually had several legislators reach out to me just with some general questions, and so I think I'll kind of address them as we go as well. Since VNA had turned over contact tracing and the follow-up to Iowa Department of Public Health, any new positives that come into our county are now being handled, that case investigation and the follow-up is being handled by Iowa Department of Public Health. VNA still receives notifications of all positives in the community, and we are able to look into that state software system and get some general information that Iowa Department of Public Health collects when they do the contact tracing. In terms of any facility, and particularly the one that we're working with our outbreak in Dubuque County, I have spoken with the administrators very routinely. They send me a spreadsheet of all the staff and all the residents and their testing and when they were tested, when the results were received. And I've worked with this particular administrator on staffing and giving the listserv for potential staffing availability in our community. I've helped coordinate some of the test kits, provide repeated testing at this facility as well. They've worked very well with VNA, and I also have asked one of our epi nurses to have a standing daily meeting with them to go over resident symptoms, make sure that they are getting better and providing any guidance and support they need in terms of, layout, facility plans, things like that. So we are keeping in very close contact with them. And like I said, they've worked really closely with us. Iowa Department of Public Health has worked very closely with them as well. And I think, you know, we continue to do that communication. I'm going to reach out just based on my conversations with the legislators to ensure that the contact tracing and the follow-up is being done for some of those facility positives. But in terms of our role with DNA, we are working with them routinely, and our FP nurse will be following up with the administrators and checking in on all the residents' well-being daily until this outbreak has passed and everyone has recovered.
Thank you, Stacy.
Stacy, this is Diane Heiken. I'm assuming then that as the situation there has progressed, then you've been giving different guidance? Is that what you're saying?
We've been working, we've been working with them as close as we can, and Iowa Department of Public Health is as well, making sure that they have the appropriate PPE, they have the availability of that. Staffing was a concern, and we were able to provide that with them too. So we're really looking at what immediate needs they have in order to best serve the residents of this facility, and we've been working to try and mitigate a lot of that.
Can you tell me where their numbers stand now, if there have been any new cases since last week on Wednesday, and if they're still testing kind of on that rolling process?
I don't have the numbers on the test in front of me. I'm sorry, I'm not in front of my computer, Diane, but I do know that they are rolling testing. So multiple residents and staff have been tested more than twice. So they are monitoring that situation very closely. And I can follow back up with you on any numbers. I just don't have them in front of me right now.
And
okay, thank you.
I'm sorry. On the Iowa Department of Public Health dashboard, it does have 49 positive cases and 12 have recovered. Didn't mean to interrupt. Sorry.
Thank you, Patrice.
Stacy and Patrice, this is Diane Pape Freiberger. So with the institutions, the facilities that both residential and long-term care facilities that have one or two positives in it, they're still not considered an outbreak, so they won't be on the dashboard or reported. Is there any more information available to you that you can share with the Board of Health when there is one or two versus three or up?
Sure. Absolutely, I can. If there is a positive, even one case in a long-term residential facility, they are in contact with IDPH, who right from the very beginning was the one that Stacy and I had talked to with a new initiative. So that person from IDPH then connects with either the director of that long-term care assisted living or residential place or their director of nurses. And it's my understanding during that conversation between those two people, they then would be offered to probably retest their staff and test the resident. But we just make sure that that connection is in place between IDPH and either the administrator or else the director of nurses in a facility. And then the conversation occurs between them.
And I do have, this is Diane Pape Freiberger, I do have one question on isolation procedures. From what I understand, from the very beginning, these facilities had isolation rooms or separate areas. But when you end up with that many individuals within a building testing positive, how do they separate out those that have positive from those that don't?
I can answer this a little bit, Patrice. I know that when we're working with the facilities, they they submit a layout plan to Iowa Department of Public Health, and they kind of go over what their, I guess plan A, for lack of a better word, would be. And then as more positives grow, they look at, how can they prevent the spread within the facility, keeping staff in one wing and not crossing the staff from one wing to another, and doing the best that they can with the space that they have. And I do know that if a facility feels that they cannot care for the residents, Iowa Department of Public Health would work with them on transferring residents as well.
Thank you.
Patrice, this is Diane Heiken again. In following up to your answers that you gave us about the long-term care facility guidance, so what I heard you saying was that we don't have the ability as a Board of Health to mandate compliance, and I'm assuming you meant like with masks, gloves, other things like that. But what I would like to see is some sort of a mandate regarding notification, so that when a long-term care facility gets one positive test back, whether it be a resident or a staff, that they immediately notify the staff, the residents and their families of that positive, and let them know if their loved one, if their family member has had any contact with that positive person. Do you have any sense, and maybe CJ can chime in on this, does anyone have any sense of whether a notification mandate is something we could pursue?
I do not know. Is CJ on?
He was.
Yes, I'm here. Yes.
Okay.
Can you hear me?
Yes, we can hear you, CJ.
Yeah. I'm sorry, Diane. Well, what was your question?
Well, it's the question of, I think it's been explained to us that we can't mandate some of the PPE requirements or procedures, but I'm wondering about a notification mandate, because what we heard from a family was that when their family member, when they found out that there was an outbreak, they weren't notified if their family member had been in contact with a positive person. People aren't really hearing about cases in the long-term care facilities, not in an official capacity at least, it seems, until there are several. So I would like it to be that as soon as there is one case, whether it be staff or resident, that residents and family members are notified, and that they're also notified within a timely period whether their loved one was in contact with that positive case. Now, in my mind, that's a notification mandate, and I don't know if that's different, if we would have the opportunity to pursue something like that or not.
And Diane, this is Patrice. I know that a lot of the long-term care do have corporate offices, and that they do have to follow the guidelines from the corporate, but then I'll stop there and I'll let CJ talk.
Yeah, Diane, I from the document that I've reviewed, it seems that the chain of communication goes from the long-term care facility back through the Iowa Department of Public Health. As I understand it, the position of the local public health director, like here, Patrice, is to work with those long-term care facilities, work with the IDPH. And I think I might have sent you a note about this, but I think, it's between, they're certainly allowed to run their facilities in the manner that they see fit and what have you. So I think that's sort of where the line is drawn with those kind of items. So to me, it would be kind of a cohesive working agreement or arrangement, or more of an arrangement, between Patrice and those care facilities to work through those kind of specifics of what is your policy in the facility when these things happen. And we as a public health entity see the need to be this or that, and to try to work with them to formulate those policies.
CJ, this is Diane Freiberger. I think what we're looking for is consistency among facilities also, but your response just said there are, and we know that there are some in Dubuque County that have already notified family members when there's one positive. But what we would like is a consistency but if we have to wait for corporate, then that consistency would not be there.
Sure. Well,
Yeah.
and I think it's probably one of those logistical things that, trying to work closely with them so that there is that consistency, whether it's to begin with in the community as a whole, the county. And I'm sure dealing with corporate entities is not easy. You're talking about something that really pertains to an individual or a small number as concerns their families. It's easy to get lost in that huge shuffle that way. But I think that's something that probably is just taking a proactive role by the local boards of health to work with those care facilities so that they know what it is that their community wants specifically.
CJ, this is Diane Pape-Freiberger. You just said the local boards of health to be able to work with those facilities. So that takes me to the question that I had posed to Patrice, and she had sent to you for an opinion on whether the Board of Health can be informed when there is positives within an institution, a facility.
Yeah, right. And I just have not had a chance to dig into all of that, Diane, and my apologies for that. And I can certainly do that before the next meeting. I will those to you.
Diane, I guess this is Tom Beschen. From what I'm hearing, we can ask, but we can't demand. We can't mandate. That's up to the Department of Inspection and Appeals. I mean, it would be nice if everyone cooperated and we got everything we asked for, but we're not finding that to be the case.
Yeah, I just thought it was worth exploring it. It's a little frustrating to me that we can't, we have those isolation orders that we can kind of impose on an individual, but it seems like we're running up against a wall when it comes to larger entities. It's I don't know if it's a business thing or what, but I just wanted to explore it. I think it made me sad last week listening to that family, and I just really feel as much information out there, as much transparency as possible is best for our community. I understand though.
Okay, thank you, Diane. Okay, so did I hear that, CJ, you're going to continue to look at this and give us an update at the next meeting? Yeah? CJ? Okay, now, all right.
Tom, can I make one more statement? This is Diane again. Patrice and Stacy, is that something that you could ask the long-term care facilities to do voluntarily?
Absolutely. In fact, we do have weekly webinars with long-term care. I believe, I don't know if there's one tomorrow or not because of the Monday, holiday yesterday. Yeah. And even if we can't ask it that way, I can send out an email.
Thank you. I think it doesn't hurt to ask, so I appreciate that.
Okay.
So the question would be what is the policy for notification to family members if there is one positive?
Correct.
Sure.
What is the timeline that they're notified, and what is the policy regarding letting them know if their loved one has been in contact with the positive?
I will do that.
Thank you.
Uh-huh.
This is Susie, can I make a statement? I think my father's in one of the long-term care facilities in Dubuque here, and I really enjoy the policy that they've taken. I get a weekly newsletter, and then I also throughout the week, if they test anybody, staff or residents, they give me an update on that. And I think it's the transparency and the open communication, it seems to it puts me at ease, puts my father at ease too. Because if he doesn't hear it right at the facility, he hears it through me. If we could get something like that in place, I think that would be wonderful.
Okay, thank you, Susie. All right, item number 3 on the agenda was the Board of Health COVID-19 message update. And this is, the discussion happened last week at the joint meeting that our stay home or stay safe, stay at home message may not be the appropriate message as we move forward through the reopenings. And what is the message we as a Board of Health want to put out in front of people? And we had some one-way communication on that, so to speak. So I'd open it up to the Board of Health members for what do they feel that the appropriate message is to share with the community at this point?
Tom, this is Diane Freiberger, and I had sent some of those one-way communications. What's happening in Dubuque County and throughout the whole country is scary right now. In 2 weeks, we're going to see another increase in cases just because people are not following any mitigation strategies. I think that the big message that we need to send is this is not over. And again, like I said the last time, it has to be a positive message, one that we are wearing masks out of love for one another or out of respect for one another versus this mask shaming that's going on right now. If people wear masks, people are looking at them strange. The biggest mitigation strategy we can have right now is people wearing masks.
Yeah, I agree with that. And I think as a responsible citizen in Dubuque County, we can forward that message by putting our mask on. And we're wearing it as a badge, not as something to hide behind. But is that it? Is there more?
Tom, this is Diane Freiberger. And there's been several places that I went last week that have recently just opened up. And the wearing of masks at one location was 10% at the most. The other one was 40 to 45%. Both areas are with large populations. Both places I left because of that. Real quickly, I left. Now, I have sent an email and I have offered to the Dubuque Farmers Market that I would come down there as a Board of Health member if anyone else wants to go with me. And I have 100 masks that I've had someone make for me that I will hand out down there with, a sheet telling them the importance of wearing masks, those kind of things. Nothing can be mandated. They want people to be wearing masks at Farmers Market and in these other places in Dubuque. The facilities themselves want people to be wearing masks, but they cannot mandate it. I keep hearing from them, well, we can't mandate it because the governor or the president has not mandated it. So I am offering these 100 masks that I have, and if any, I can go down as a Board of Health member if that's appropriate, and if someone else wants to go with me to hand them out on Saturday morning.
Diane, this is Tom again. I have a little bit different view on that. I think as a business operator or as a person who manages an establishment or a venue of some type, you can mandate a mask. I witnessed it this weekend at Menards. Person walked in the door, That person was turned around and sent right back out because they would not put on a mask. Now that's tough to do. That's turning business away. But that's sending a message.
Well, I know that we do have these businesses do want to be able to mandate. I think that they're afraid of turning business away long term, and possibly that is why when they are just trying to open up.
Yeah.
But I would love to mandate masks, but we don't live in South Korea or in China. We live in the United States of America, and when we have our leaders not modeling that for the public, they think that the public thinks that their rights are being violated if they're mandated to do anything.
Yeah, I understand.
This is Stacy. I don't know if I can speak, but just my thought on this is maybe send out some press releases or some media about
Stacy?
Yep, can you hear me?
Yeah, Stacy, this is Tom. I'm going to have to ask that, this is the Board of Health's discussion time right now. I'm going to have to ask you to honor that. Thank you.
Sure, sorry about that.
No problem. Okay, so I agree. Wearing masks is, I think, a big part of the message. But how do we communicate to the people that are asking us, can we go ahead? Is it okay if we start having these baseball games again? Is it okay if visitors start coming in from Chicago to see our museum and things like that? What do we, as a Board of Health, want to be conveying to the public?
You are unmuted.
I was wondering if Diane Heiken wanted to talk about what she sent out about the Mask of Wellness. I think that's a good campaign. There's a toolkit kind of already there. There's a backing for it. I think businesses can adopt it. In fact, I sent her a post today I saw on social media where In Focus Pharmacy had the logo and said they were participating in Mask of Wellness, and they have a sign up. I'm wondering if this is a message we can adopt and get behind, and if Diane has anything to add, I would like that.
Sure. Thanks, Susie. Well, when I saw this, it's a program that was developed by a pharmacist, and it was kind of shared through the Iowa Pharmacy Association. And when I saw it, it looked as if it kind of addressed all four pillars that Dr. Canero had sent out in an email. So I don't know, Bobby, if you're still on, if you had a chance to look at the Mask of Wellness website, but I think you wanted four things addressed, and it was social distancing, which is addressed by that program. I think you said screening, which I believe it addresses. What else did you say? You said masks and hygiene.
Hygiene.
Correct. So the Mask of Wellness program, anyone can look at it. And it sounds as if the In Focus Pharmacy, as Susie said, has signed up for that and actually gotten the resources. But it talks about all of those aspects for a business, and it's free. A business can go on the website and sign up. So it's got a section on masks. It's got a section on hygiene that includes personal surface and distance hygiene, and then a health section, which is a daily health self-certification, which is basically a screening, I would think. I don't know if it's for the employees and guests, customers that come in. And that's, Susie, did you talk to them today at the pharmacy, and did you get any sense of what the other resources were that were available?
I was not able to get away from my phone today and go down there and talk to them. I highly regret that I wasn't able to do that.
So, but you did see like some signage? Is that what you saw then that alerted you to it?
I did. When I left work for the day, I saw some signage, but they were busy and I had to leave. So,
Okay. Okay.
but they did have it out on social media.
Okay. So, I mean, I think it's a resource that any business, in our community can look into. And I was wondering if even we could promote it as maybe, any other entities, for instance, religious entities, they're going to have to be making decisions. Groups, whether it be teams or any other kind of clubs, these are the basic 4 things that Dr. Canero brought up. And I was just kind of surprised when he brought it up, and then the next day I saw this program being promoted. Their daily health certification it's a list of symptoms, and I think it's probably actually a piece of paper that the person can fill out. It's a downloadable kit that has a screening form and some other signage, things like that, educational pieces.
Yeah.
Sorry, go ahead.
Oh, you can go ahead, Susie.
Okay, so I was just wondering if the Board of Health could get behind the mask of wellness, not reinvent the wheel, and help push this out. I think it's kind of the best of both worlds. It's covering those 4 pillars that you were talking about that medical wise we're talking about. It also talks about wearing masks just to keep everybody safe. It's a positive message.
Ed, are you on? Have you reviewed that program at all? I know you've been working closely with.
I'm reviewing it right now, Diane.
What? Oh, you're reviewing it right now? Okay.
I put it in the sidebar there in case anybody'd like to click on that and go to it. I think I follow some information from the corridor. I'm not sure exactly when they started this, but I haven't seen too much of it, so that must mean that it's pretty new. But it from the standpoint of how that might work into employers, whether those are nonprofits or businesses, it would be an interesting thing to at least later tonight. I can send that to a couple of our partners that I'm actually drafting an email right now to the city, asking Randy Gale to take a quick look at that. So maybe we can kind of take a temperature on that. Randy Gale had, thanks to, I think it was Patrice, just at the very end of last week, had put together some information that the city is already beginning to do some stuff with that came from the Iowa Department of Public Health regarding some of these issues. So they were doing that. Iowa City area with the University of Iowa and the University of Iowa hospitals and clinics sometimes has a lot at stake, and they have spent some time working on this. It looks like, and that would be something to potentially, as Diane Hyken just said, not reinvent the wheel. We've already adapted a few things from the Iowa Department of Public Health. This might be another one that might be more of a campaign sort of thing, perhaps through some of our partner organizations that might help if they like to roll something like that out. So I'm happy to do that. Assist the board if that's what they'd like to do.
And I'm also wondering if there's a way we could incentivize, maybe not, I'm not talking financially, but, maybe some type of getting the word out, and if they sign on to this, their name gets added to the list. I don't know. I'm definitely not a PR person, but if there's just maybe a little more incentive for them to adopt it too.
Currently, they have a map. They have sort of a category thing. Most all of the things are in the Iowa City, Johnson County area, and a few companies outside of that. But the majority of them are inside the inside Johnson County. Certainly not everyone, but it's companies that are from salons to actually it's a lot of salons, quite honestly, and some retailers. So as opposed to being exclusively heavy hitting big employers and things, it's less of that and some churches, retail, personal service companies.
Okay.
Which may very well be some of the target that you're speaking about, Susie.
Yeah, and Susie, this is Bobby Canaro. just to add to the importance of masks, which I certainly am in agreement with. The reason why I'm pushing a little bit more of a comprehensive goal is because masks by themselves, I don't think are going to solve the problem. As you may have heard about the hairdresser from Missouri that wore a mask, and all of their clients wore masks, but she was symptomatic and she infected 91 people. I think that we have, businesses are looking for guidance from us. I just got a call earlier today from a owner of a fitness club, and he was asking for what protocols they need to do. And people in fitness clubs are not going to be wearing masks when they're working out. So I think we need to have a cocktail of things that we know work for businesses. Mm-hmm. The reason why I picked the 4 that I did is because the hand hygiene, social distancing, masks, and screening has been done by medical offices and clinics that never shut down during the lockdown. So we know that those work. And then if you look at some of the more successful businesses throughout the country, like take an Apple store. If you're going into an Apple store, the first thing they do is they screen your temperature. They make you wear a mask. They wipe down all the surfaces, and they make you stay 6 feet apart. So I think those 4 things are critical. So I think if we're doing a messaging for businesses, we need to incorporate all 4 of those.
That's what that toolkit or mask, it's about all of that. Because you're not going to get everybody to wear a mask, and you're right, masks don't do it. It's not the answer to everything. And I've gone more to, with my social work mind, we need to do harm reduction. We're not going to get everybody to follow the rules, so let's throw some stuff out there like those 4 things that we know work, and Yep. Maybe we can't get everybody to wear a mask, but hopefully we can get people to wash their hands,
Yeah, if you can't wear a mask, practice hygiene and keep yourself 6 foot from anybody. It's kind of like you can fashion a safety net using multiple parts of it.
Yeah, but if you can even do 3 out of those 4, then that's pretty good. I think one thing that we're not talking about very much in the businesses in Dubuque is our screening, though. I really have not seen much of that at all.
Screening, this is Ed. What kind of screening do you meet? Could you elaborate on that, Bobby?
If someone walks into your business, or even, I'm not sure about the employees. I'm speaking from, for example, in my clinic, if someone were to walk in, the first thing that gets done is a temperature check. And then we ask if the patient is having any symptoms, right? I think if this hairdresser in Missouri, if they would have employed that particular protocol, 91 people wouldn't have been infected. Because
the message, what is our recommendation for when and where masks should be worn? What is our recommendation for, I had a question about the softball games opening up here in 2 weeks or 2.5 weeks. What guidance is there from the Board of Health for how they should address that? For the time being, I think they need to follow the guidance that Iowa Department of Public Health is putting forward. But unless we've got something beyond that, I think that's the only guidance we can give at this point. Anybody feel differently?
Tom, I support that, in that even in her conference today, the governor did again address, she doesn't mandate, but she did address that, number one, if you're over a certain age or if you have health issues, you should be staying home, limiting time out. But that people that are going to be out in public interacting with each other should be wearing masks.
Right. Yeah.
Yeah, I would like to reference the case example of there was a big pool party in Arkansas, and you know, I think people thought that they would be safe because they were outside and in a pool area, but the majority of everyone at that party got sick with COVID. They were positive. So I think they thought that they were social distancing, but it just comes to show you that if people are yelling or singing or screaming, like what you would see in a sporting event, that it's possible to spread this virus further than you think through respiratory droplets.
I remember seeing once, Dr. Conneru, that a sneeze can travel 30 feet.
Well, and there is, you know, they talk about the spray and they talk about the vapor that can also be there if you walk into that vapor of the virus or holding that virus. And now that Leisure Services has just announced that the Dubuque pools are going to open June 15th, that is very concerning to me. I do not know what their mitigation strategies are. We cannot stop them from doing that, but we definitely could address our concerns. And I think that when these places are opening up, they're not coming to the Board of Health for sure. They're not coming to the health individuals that could give them guidance. You know, they're just opening up based on the bare minimum they have to do.
Diane, do you think that's a fault of the Board of Health for not being more visible, or do you think that it's more misunderstanding about who is setting policy? I wonder why that is.
And Bobby, I don't know. Maybe we could get feedback on that, but I do not know.
Yeah. Well, I'm just glad that some people are starting to come to us now. Okay. Well, anything else on that item?
Tom, this is Diane Pate Freiberger. The other thing is, I think that we do need to give some guidance because there are places in Dubuque questioning whether they should open up or whether they should have, now we can have music events. You know, can you envision music on Main or jazz, you know, downtown with the even if at 50% capacity and people drinking and eating, those kind of events, they'll be starting about the time that this two week from the Memorial Day is the potential surge is going to happen.
Wow. Okay.
Bobby, do you have any feedback on that as far as should we be giving some guidance to places that want to have these music events that include drinking and food?
I do think we should give guidance. The only question I have is how much authority do we have? Because it seems like everyone is interpreting what the state guidelines are, right? I'm assuming that they're going off of that.
Right.
So do we have any, I guess, wiggle room or latitude to be able to modify that according to Dubuque County, or do we go with what the state is recommending?
I would expect that the state is more general with some of their guidelines, And I think they're looking for local direction here. From what I'm understanding from these individuals, they're looking for more local direction, just like Lake of the Ozarks. You know, they were looking for, they didn't get well, they did get direction, but no one enforced it, I guess, is what happened down there. But I guess if we do offer guidance, you know, to slow down just a little bit here.
I mean, I think we should offer guidance regardless, because if nothing else, it's going to make the Board of Public Health more visible, and I think that needs to happen. Just because I think people are looking for guidance, and I think now is the time for us to get more visible and vocal, so that, you know, we could start sending out the right message.
Okay. Yeah. Okay. Well, Diane, who has anyone approached you asking for advice?
They not direct advice, but hoping that we would be able to give them advice.
Okay.
And I cannot offer that as a Board of Health member.
No, I understand that, but has anyone come to you as a Board of Health member saying, what does the Board of Health think we should be doing?
Yes.
Okay. And that has happened with me here in the last week too. So I think we owe it to those people to be responding.
This is Ed Graber, Chair Beshen, and I would add that Kristen Dietzel from Greater Dubuque Development, that has been presented to the Board of Supervisors and Board of Health a couple of weeks ago about their Safe at Work initiative. That's a digital document, not very long, 12 pages. They're looking at already at doing a freshen on that. So they're interested, and they've been one that's an organization that's been pushing that document out, at least to their members and employers in the community. It does not exactly do what the initiative that Susie and Diane brought to our attention this evening, but it's kind of part of that. And I think that in reaching out again, Kristen is looking for updated stuff. Is there something else that we should be doing? They're trying to refine how that goes in the messaging for them too. So this seems like an appropriate time to be working with our partners.
Can you hear me? I've tried to talk a couple times.
Yeah, Susie, go ahead.
Something was happening with my mic. Nobody could hear me. I think before we start offering guidance, we need to have a message.
Yes.
I think if we chose to adopt that massive wellness and people ask for guidance, we can say, here's a toolkit. Here's what we think you should be doing. You know, the hygiene and the distancing, it's all in there. So again, we don't need to reinvent the wheel.
Susie, I think that above that, that they're asking for guidance. It's sort of like, well, do we allow these? I'll just use music events to happen. You know, if so, then how are we going to negotiate the crowds that we are allowed to have? How do we do food? How do we offer alcohol? Those kind of issues is what they're looking for direction on, not on whether they could wear masks, because if you're eating and drinking, you can't have a mask on.
It's not just about masks, though, that toolkit.
Oh, that's right. There are other
things.
There are other things in there. But I'm saying what they're looking for is this other direction.
Yeah, but I still think we need a message before we can offer guidance.
And I agree with that.
Okay. So let's take some time this week to work on our message. I know that probably not as rapid as some people would like it, but I'd rather do it right. So we'll bring this back to the agenda on the 1st of June. I think that's Monday, yeah. Okay, good discussion. Thank you, everybody. At this point, unless there's unless there's something else on the guidance, I would like to offer public comment. And again, like Dave Baker said, at this time, anyone may address the board on matters which are of concern to that person and which are not on agenda items. Please raise your hand on Zoom and state, give your name and address. Please be aware the board is limited in how we can deliberate on this because of the Iowa code. And I'd ask that you please limit your comments to 3 minutes. Okay, I see no hands raised, so I guess I would entertain a motion to, since this is not an official regular meeting, a motion to recess until Monday.
This is Diane Pape Freiberger. I do have a question. We had proposed on April 1st that we would have one joint meeting with the Board of Supervisors and then a second meeting that week that was just for the Board of Health. And so things like a lot of what we've discussed tonight could be addressed just with the Board of Health and brought to the Board of Supervisors with what.
Diane?
I got muted by the host, whoever, but anyway, I recommend, April 1st, we had a discussion, and at that time, we decided that we would have the one joint meeting with the Board of Supervisors per week, and then the second meeting would be only with the Board of Health. And I'm just wondering whether people would entertain that idea again. We did vote on it, and we voted 6-0 on that we would do that. And you were going to talk to Supervisor Baker regarding that to see if that would work out. And Patrice would not have the second meeting that week with the Board of Supervisors. She would have it with us. Is that still an option?
We did put that forward. We didn't speak with Supervisor Baker, but the feedback we got was that Patrice would be required to present at the Board of Supervisors meeting both times and then again at our meeting. So that would create another meeting for our Director of Public Health.
Yeah, and we did not want that.
We did not, that was part of the discussion. We did not want to create a third meeting where she would be basically repeating the same thing that she repeated earlier in the day. So I guess I would ask that the Board of Supervisors consider that request, because I think there is a lot that we can do that wouldn't tie up your time. So,
Tom, this is Dave Baker. I think having the joint meetings is, probably the best way to make sure that we all know, what we're thinking, having good discussions on it. It sounds to me like some of your folks maybe want to have a separate Board of Health meeting to fine tune some things and then bring it back to the Board of Supervisors. And I know that to this point, that's been viewed as a redundancy. So I don't want to try to tell, you or the Board of Health how to run your meeting. So I think that's an internal decision by the Board of Health.
Okay.
That's just my view of this. I'm perfectly fine having, because I've had people say, well, could we do a separation, because then when we have other business on the Board of Supervisors agenda, we don't, people don't have to, if they're not inclined to do so, listen through the COVID-19 reports. We've been adding what we view as essential things, and some things to keep moving so that we don't have, a big backlog when we come out of this, whenever that may be. But I think having the joint discussions is actually positive. I think we're learning more about how we're thinking, and that we're not that far apart on this battle against this pandemic.
This is Supervisor McDonough, if I might. I know your board was getting ready to adjourn, Tom. We have 25 department heads from the Board of Supervisors meeting. We have another agenda item that we will have to go to. So if you're not looking to make some decision about this, maybe we can just meet again on Monday and you can, take it from there. But, it just for purposes of clerical assistance tonight, these folks are still here working at 8 o'clock at night as well.
Okay. All right. I would be perfectly willing to put this back on the agenda for Monday and have a discussion on it then. Because these meetings get pretty long, and to tie up that many people, we've got 36 participants on the call right now. So these are tough times. Okay. All right. Diane, are you okay with putting it on the agenda Monday?
Yes, thank you.
Okay. All right. Well, then can we have a motion to recess the Board of Health meeting until Monday, the 1st of June at 10 a.m.?
This is Diane Heiken, so moved.
Thank you. Second?
This is Diane Pate Freiberger, I second.
Okay. All right, make it official. Let me go back to my list here of who's here. Susie Stroud?
Yes.
Diane Heiken?
Aye.
Todd Lang? Tom Beschen? Aye. Diane Pape Freiberger?
Aye.
Dr. Bobby Conneru?
Aye.
Aye. Motion carried 5-0. Thank you.
Okay, thank you, Chair Beschen. Dave Baker, we will go to the next agenda item and last agenda item, which is the reopening update. And with that, I'm going to defer to Dawn Sherman.
Thank you, Chair. I would like to focus on our time on 3 different issues that we would need guidance from the Board of Supervisors on. The first one is the public access restrictions of county buildings. The current restrictions you have in place are set to expire on May 31st. The second one is going to be the COVID pay practices. That is that emergency policy, and that too is expected to expire on May 31st. And then just a very brief conversation of your continued meetings via Zoom. So going back to the first one, I had convened the department had sent out a survey and then had asked for them to put together kind of their status report, where they're at And many of them were just very brief, a couple sentences. So I just want to summarize what the feedback I received from the department heads. Almost all of the departments are and will continue to encourage customers to utilize the online, the telephone, the mail, the email options versus coming into county buildings and having face-to-face interactions with staff. So they will continue to do that. I think, as you heard from Judge Schubat this afternoon, the courts have pushed back their in-person trials as well into July. Many of our departments are going to continue to would like to limit their in-person services that they deliver. In the courthouse, two of our biggest departments that have a lot of foot traffic would be the recorder's and the treasurer's office. The recorder has anticipated not only doing by appointment meetings for the foreseeable future. The treasurer confirmed this morning with me that he is looking at least 2 weeks where he would not be opening his windows for in-person service. They will continue to answer questions on calls and email and the mail as well. So those are two of our biggest ones. A lot of our West Campus departments have recommended that we continue our current restrictions, our current practices when in regards to public access. They said that has been working for them. And so those are some of the things around that building access, kind of a summary. I would say an overall consensus that the departments like what we have in place right now and would like to continue those. There are some departments that have opened up. The Sheriff's Department has opened up or will be opening up the lobby regardless of what we do in other county buildings. So I know that was one. Specifically, the libraries have opened up as well. So we're looking, again, mainly at the courthouse, the old jail, and the West Campus for these limited building accesses. So my recommendation was to continue the current restrictions since we do not anticipate an influx of people coming to the courthouse for the courts or for two of our biggest departments, recorder and treasurer, at least until 2 weeks. That's when the treasurer had said he would, at minimum, he would keep his doors closed. And if any public were to come into the building, that they would be required mask. I'm looking that not be, or if there is a requirement for employees, it would just be in common areas. And when they go into other departments, many have stressed that they could social distance within their work areas or have put up some preventative measures to allow that to happen in there. So those would be my recommendations for the building access based on feedback from the departments.
Okay, wow. I'm going to have to digest a little of that. What are we looking for tonight as far as decisions?
Well, right now, your previous decision was only to continue the public access restrictions through May 31st. So if no action is taken, then June 1st, we would allow the public to come in without, right now at the West Campus, I'd mean unlocking the door because they have that locked and they're utilizing phones and email. We would be giving direction to the courthouse security to allow people in to have their services completed in person.
Okay, thank you.
And just to reiterate, that's not the direction, that's not my recommendation, and that was not the consensus of the department heads and elected officials within their building. They are all are able to unmute themselves if they would. Well, I do not want to speak for them, but I was just doing a general consensus if that's, if they have any additional information.
I'd like to be heard for the judicial operations because I think there's a few different considerations and some guidance that I need from the board tonight that I think is it's just a different situation from the other departments. So if I may, as I indicated this afternoon, as I think you already know, we have an order from the Supreme Court that says that we can begin having in-person hearings in cases that we want to do it if the courthouse is open to the public and if we meet certain criteria that are to be established by state court administration. I don't know what the criteria are because state court administration has not come up with them. Hopefully we're going to know that this week. But as far as the open to the public language, people sought some clarification from the Supreme Court on that. It hasn't been forthcoming. We don't exactly know what open to the public means. My interpretation, and talking it over with Judge Lekar, she shares the interpretation, is that from a judicial standpoint, we're open to the public if the board gives us permission to do the hearings that we think are necessary or that we need to do. What we've been operating under since the middle of March, when the courthouse was shut down, is the discretion granted us by the board to go ahead and do the hearings that we think are absolutely necessary that we have to do in person. In other words, the board didn't endeavor to try to micromanage what we were doing, but gave us that discretion, and we've exercised that discretion very conservatively and have really tried to keep it to the bare minimum of hearings that we're going to do. For our operations, assuming we meet whatever criteria are put in place, I would like permission from the board to continue basically under the same arrangement that we've been operating under since March, and just let us decide what hearings it is that really need to take place in person. I assure you we're going to continue to do them by phone, by video, everything we can possibly do to keep traffic down until we're like everybody else. I mean, we need to get our legs under us too. So it's not our intention to just have as many people as we can flooding into the courthouse, but we would like to continue with the discretion from the board to basically have those hearings, which I think is where we have been.
Judge Schubert, are you anticipating increased traffic? I think we need to, in fairness to our security team, we need to know if we do that, how much traffic are you anticipating? And we need to talk about what requirements we have. Are we going to I'm hearing some back.
Hey,
are we going to take temperatures? Are we going to require masks? I think we need to talk about all that before we open the doors. If we take temperatures, who's going to do it? I don't think our security team is predominantly made up of retired law enforcement professionals. Many of them are at the age where they are considered at risk. So we really need to have a plan in place before we do this, and I think that I don't see a written plan in front of me here for reopening. I know we've had some surveys. I think perhaps we need to have this ironed out. I saw one of the things in the survey that we want everybody that comes in here to wear a mask, but the employees don't necessarily want to wear masks. I've talked to other employees that are okay wearing masks when they're around others or in common areas. If they're off by themselves in their cubicle, and they're socially distant, appropriately socially distant, maybe they shouldn't have to wear it. So we need to have all that worked out before I think we open the doors or the floodgates, whatever you want to call it.
And Supervisor Baker, I agree with that, and that's why my recommendation, I think, echoes Judge Schubat's, is that we would like to continue to have these limits. We have not received the guidance from the task force from the states. They were putting together a task force to give guidelines of cleaning and how to social distance, jury trials, and we have not seen that yet either.
Okay.
And that would be a tremendous help for our courthouse security team.
I
So
mentioned,
Supervisor McDonough. Go ahead, Dave, I'm sorry.
I had mentioned earlier today that NICC was in a meeting with Dr. Wee, of course, a virtual meeting, and they do have a COVID-19 return to the building, return to work training program in place, and they're offering that for free. And so maybe we should reach out to them. I would ask Dawn Sherman and Ed Raber to check with the NICC folks and get us, let's put our plan together. I agree, we need input from the state, and I'm not opposed to treading water here for, a couple more weeks or whatever it takes. I don't know what, if Treasurer Stearman is in the meeting. I'd like to hear from him if he's saying he's opening in 2 weeks, or is he saying it'll be at least 2 weeks?
My discussion with him was at least 2 weeks.
Okay. And he probably generates, at certain times, more traffic than any other department. But, the courts can generate a lot of traffic as well. But it looks like that can has been kicked down the road to September, is the way I read it.
That's not, it's actually been, we're not going to have any jury trials until September 13th. The date that we had been operating with was June 1 in terms of starting up with other hearings and then some other bench trials and those types of things. That June 1 date has now been moved to July 13th with the provision that if a courthouse is open and we meet these criteria that state court administration comes up with, that we could hold hearings beyond emergency hearings and other things that couldn't be continued at the courthouse before that. So all I'm looking for is I just want to make sure that at the very least, come Monday, we're still going to continue to hold hearings at the very least on an emergency basis, and you'll let us decide what is an emergency and not an emergency, which is pretty much how we've been operating for the past 2 months. Is that?
Supervisor McDonough, and what I'd like to suggest is that we look at June 15th, that we continue the current restricted public access as it currently is till June 15th, while administrative team works on a written plan to reopen the county, so that these questions are decided by people who are going to be looking at it every day. What are we going to do? How is law enforcement going to handle the front? I mean, we have moved now to knowing that the state's fully opening everything, and so we have to have a response. I'm not sure we're going to actually be open in June, but if we don't have a target date to start planning for this, we will limp along like this for a long time. But it seems to me that by June 15th, which is a Monday, we should have an action plan, if not sooner, to reopen the courthouse. Whether that's full reopen or greater access, it's something. Last time we discussed this, my thoughts were that the court system will push us. As they need greater access, we will have to give a greater thought to these things. But I think it's time for us to put together a written plan and to be able to execute. So I'd be prepared to put that in the form of a motion. We have two other things to decide tonight. One of those is about the continuation of the COVID pay proposals that we have, and then also whether or not we are going to continue to hold our own Board of Supervisors meetings via Zoom. So I would propose that we take each of those three and take action on that. I don't think we have consensus among the departments. The elected officials are going to continue to do in their own departments what they would like, and they should. We also do need to address contractors to get safe for those folks to come in and start completing projects. So I guess there's actually 4 prongs of action that I think we should take this evening. Supervisor Wickham, any thoughts?
Well, I'm happy to hit all 4 of those that you mentioned. I guess I'm somewhat confused on the court request. My instincts would be to grant Judge Schubat's request, and that didn't seem like that's where you were going as far as the June 15th date. And so if you want to address maybe the courthouse first, we want to tackle that piece
Sure.
first. Is that what the board would like to do?
Well, I think one of the reasons I'm saying June 15th is because there's some missing pieces that are critical, I think, for us to know how the court's going to prioritize certain things and what these instructions are. We won't be meeting. You know, it appears from the governor's, even her press conference today, she's fine with announcing things on, Thursday, Friday. They go into place on Monday. We can't do that. We have to have a little bit more planning for that. So, obviously the judge knows that he can correct me at any time, but the 15th date is a date to have specific written plans in place. As we put pen to paper on that, you kind of begin to see where the shortcomings are. Is there something that I'm missing, Judge Schubat?
Well, I just want to be clear, and I will tell you this: Blackhawk County actually moved their date back from June 1st to June 8th. So I mean, June 15th is fine, or June 12th, whatever the board wants to do. We will abide by what the board does. I just want to make sure, though, that when you say that you're going to push it back to June 15th, basically what you're saying in the motion is, I mean, we will still continue to operate and be able to have emergency hearings in the courthouse. We're not suddenly on June 1, you're putting us in an alternative space that the supervisors find.
No. You would continue to have the same access that you have now. All emergency matters are being attended to, I believe, under the current situation we've been operating under for 8 weeks.
Okay. And that's fine. That's exactly the guidance that I need, because it makes a difference in what we schedule. And just to comment, a question the chair asked me, very early on was, did we anticipate a big change in traffic? Whenever you make this decision, and it sounds like it will be later in June, I can tell you that our plan is to not have an immediate influx of traffic. We are going to go about this slowly. We're going to continue to use all forms of technology that are available to us to keep people out of the courthouse and keep foot traffic minimized. So
That's great.
we can take that up later.
Yep. I'll make a motion that we continue restricted public access to the courthouse and to the Veterans Administration building at the old jail and also to the West Side campus until June 15th.
I will second that.
Motion made and seconded to extend the current arrangement till June 15th. Any further discussion?
I have a question. This is Denise Dolan.
Go ahead, Denise.
Is it the board's intent to have a second motion on contractors and whether they would be allowed in the building to do certain work? Or could I request that this motion be amended to allow that?
I was intending to have a fourth motion on that. I was intending to go through 4 bullet points.
Okay.
Right. I have the fourth bullet point at the end for contractor discussion that we had earlier today as well. So, all right. Motion was made and seconded.
Thank you.
Yes, you're welcome. Okay, any other discussion on the extension to June 15th? All in favor signify by saying aye.
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 Aye. Carried 3-0. We're extended till June 15th.
All right, so the next one is the COVID pay practices. So there are departments who are now ramping up to fully scheduling their employees. Some have never changed, obviously, but some of the departments that have, I know the Sheriff's Department brought back their full office staff. Others are planning on doing that June 1st. And so then there would be very limited, if any, need for the reduced schedule leave. The departments are either continue to have their employees work remotely, or they will be on site where they will be performing their normal duties. We still have not got this pay report back. That will not be until tomorrow. But the last one, we only had 5 people to use the child care benefit, and I have reached out to some of those departments, and those are taking care of themselves. And so I would be recommending that we would let that pay policy expire and go back to regular admin policy, and now to follow the new Federal CARES Act leave, which is still allowing for leave for childcare. It would be at that 2/3 pay, and it would be up to 12 weeks. We've had some who've just taken it intermittently a day or two, and so they may continue that. And then also there is COVID leave if someone is mandatory quarantine or who has contracted it, they get up to 2 weeks of full pay. So my recommendation would be that since the staffing levels are no longer reduced as they had been, or there's not that anticipation for that beginning June 1, that we would let that policy expire.
Dawn, I understand that is our decision to make, the supervisors, but was that discussed or was that anticipated with any of our department heads? Once again, I don't want to have unintended consequences because we haven't looked ahead.
Yes, one of the questions I asked, if they currently have employees who are requesting leave due to childcare and requesting leave due to the COVID, like if they have a CDC high risk condition and they don't want to. So I did ask that in my reopening questionnaire to them.
Okay, very good. And then relative to the work at home, if we allow this COVID pay policy to expire on May 31st, how are folks going to be working remotely? I mean, because we're not going to be increasing greater access until June 15th at the earliest. Will each department be doing that? Are you coordinating that?
Each department would
for work at home.
Yeah, continue to determine which employees, if any, would have the ability to work from home.
So that is not something we'd need to decide tonight.
No, that's not. That is not.
Okay. I'll make an affirmative motion then that the COVID pay period would expire on May 31st as currently written.
Is there a second?
I will second that with some discussion.
Motion made and seconded. We're open for discussion.
My question would be, I think the other component that Don would mention was that we then follow the CARES Act as far as their policy. Don, is that what you're recommending?
That is correct. And then also, if there are employees who have what the CDC considers they're considered high risk, that if they're asking to rework remotely or to have a reduced schedule, that we would look at that as recommended by the EEOC as an ADA accommodation. So that would be on a case-by-case basis. We would evaluate those.
So what would that motion look like, Don?
Well, and maybe, yeah, maybe I'm not asking you to amend your motion, Supervisor McDonough, just a discussion that you would be interested, or the board would be interested in evaluating the CARES position related to HR and absent leave in the near future.
Right, I think we would have to comply with that, wouldn't we?
Correct. I believe most of it's through the end of the calendar year. Most provisions are.
Okay, so it's mandatory from the state and feds?
Yes. Yep. The leave for the child care, it is up to 12 weeks. And then if they have, the high-risk condition is not mandatory. That is under the, that's guidance from the EEOC regarding it as a disability or a condition that they are now overseeing, that we would have to go through an ADA reasonable accommodation process for that employee. Which could be as simple, and they've given guidance that working remotely would be a reasonable accommodation in most instances if the work was able to be done there.
Okay, good enough. I'm good with the discussion at this point.
So I think if we let it expire the 31st, the CARES Act will automatically, you will be responding then as our HR administrator to the COVID provisions and child care provisions under the CARES Act, and then also the ADA with compliance issues. So there's not any lapse there, right?
That is correct. The employees will still have rights under that act, in the ADA Act as well.
And FMLA.
Okay, so we're not,
correct.
Right.
All right. Is there any?
Okay. Very good.
All right. Any further discussion? All in favor of the motion, signify by saying aye.
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 Aye. Carried 3-0. Next up, Board of Supervisor meetings. Continue to schedule meetings via Zoom.
I'd say at least till June 15th.
Agreed.
I'm fine with that. Is there a motion to that effect?
Excuse me. This is Denise.
Yes.
I would make note for the board that the canvass of the June 2nd election needs to be held on June 9th. And considering that you have to canvass the folks that come back from the polls, it's going to be a little tough to do that virtually.
Right. So we'll have to meet to do the canvass.
And we can have a discussion. I mean, I don't, if the three of you want to, one of you sit in that back board table and the other two are at opposite ends of the board table, I don't know. I just bring to your attention the fact that I need at least two of you to be on premises on June 9th.
I'm sure we can accommodate that.
Yeah, I think we can do that.
I just wanted to bring it to your attention.
Super.
Thank you.
I don't think we need a motion to continue Zoom, do we?
No, I just need some guidance for scheduling purposes, so I appreciate that.
I would say other than the canvass of the election, we'll continue with Zoom until at least June 15th or till we decide otherwise.
Right.
Okay, number 4, this was added in, was brought up during today's discussions, some of the work sessions. Contractors, access to the courthouse during what we would call, I guess, low census. If this was a hospital or a power plant, and we were operating at half or less capacity, that normally is the time to get things done. And the question was asked, does it make sense to allow contractors in while there's fewer people in the courthouse? But I also think if the answer to that is yes, then we need to have rules for those contractors and decide, are they gonna have their temperatures checked, and other access type issues. I think, is Shane Bockenstead on? Shane, I think would like to weigh in on this.
But we might also just ask that Chris, they're gonna have to check in and check out with facilities, and that would be Chris's department. I know that Nathan Gilmore's got some information he maybe could bring to us about temperature taking options that we could look at, but I would have anybody who's a contractor would be reporting to either HR or to Chris Soder at the back door for instructions, and they should wear a mask at all times, and go by any protocols that Chris feels. I'm happy to hear from Shane, but I don't want them checking in with law enforcement in the front as much as I want them to be checking in with facilities. Maybe Chris meets them at law enforcement. I don't know.
And that is kind of how we've been doing things. If they do have somebody previously, even when they had somebody coming in, and I would envision that going forward, whether it was maintenance, IT, whoever, as long as they're doing their traditional background checks like we've always done, once those people come on site, if the board deems if we do want to do temperatures, which I don't think is a bad thing, and mandate that they wear a mask, whichever department is bringing those people in can handle that. We're always there if for some reason we're needed, but I would foresee that the department head who was dealing with that would oversee that process.
This is Chris. I concur with Shane. Ideally, bring them through security initially. We'll do all the temperature testing and making sure they have masks. And then at that point, we'll follow through with it anytime they're coming in and out of the building, morning and evening.
Chris, is your staff comfortable doing temperature checks? We could talk to the VNA and possibly get some assistance from them.
I think that's a great resource to have available, but I would assume, and I'm hoping they're very busy. I would think we should be able to do the very few temperature checks ourselves if we have the equipment.
Yeah, we have the no-touch infrared thermometers that are very accurate. We've been practicing on ourselves just to make sure that we understand how they work.
How's it working out?
Pardon me?
How's it working out?
And working out, none of us are sick, so that's a good sign. But yeah, we'll be able to do that with the contractors. That won't be a problem.
Okay. Well, if it gets to where your folks are, concerned, or it's too much, that's always an option for us.
Oh, definitely. We'll know real quick how well it's going to work for us. I don't anticipate it being a problem, but if some bugs come up, I'll be sure to get a hold of Dawn right away to see what our other options are.
All right. So I would ask Chris Soder, Ed Raber, Don Sherman, Nathan Gilmore. We need to have some rules in place for these contractors, so they're not don't have run of the building. They're practicing social distancing. They're wearing masks. all of the common sense, they're washing their hands, all the common sense stuff. So some kind of a document to put in their hands, to discussion with the contractors, to make sure that we're not jeopardizing the health of our employees who are in the building, including our security team.
We could put that together very quickly so that we could even email it out to them before they arrive on site, so they would know our requirements.
Okay. And then a question for Shane. Shane, would you be okay having the security team check on to make sure that the protocols are being followed? Maybe a little more than the routine checks that they do now. If you know where they're at, know where they're working, have someone try to break away and help when they can.
Yeah, I don't have a problem with that, and we usually coordinate that pretty well with the maintenance people as well. I do plan anyway to start bringing an additional staff member in just in case we do get some additional hearings as we start to see a few people, more people in the building. That way we can also, like I said, follow up with any of these contractors in there just to kind of keep an eye on them if nothing else is going on.
Okay, thank you. All right. What date are we looking at for contractors? I'm assuming they're not going to show up tomorrow. We need some time, Dawn.
Yeah, I would like at least tomorrow, so that I can get with that small group and we have a handout and an email sent out. And I also want to email employees in these facilities because we initially prohibited their entrance because there were employees who were concerned, why were we allowing them? So I want them to also, and I want to communicate to them what precautions we're taking for their safety in allowing the contractors in. So I would say at earliest the 28th, I think would be best.
Okay, would June 1st make more sense?
Yeah, this is Chris. June 1st to me would be a better date. It's a Monday start date. Gives us plenty of time to get all our ducks in a row ahead of time. That was my original intention, if we could do it.
Okay. Shane, does that work for you as well?
That sounds fine.
All right. So June 1st will be the date, and we'll have all the protocols covered by then.
Yep.
All right. Any other issues?
No.
Yeah, I'd like to ask if Nathan does want to talk tonight about, he put a text in the chat box. He has a proposal for human temperature taking options. I don't know if you want to work with Dawn, if that relates to the June 15th date, or if there's information you think is pertinent tonight, Nathan.
Evening, everyone. So I'll keep it brief. The reason I would bring it up tonight is if it's a non-starter, no big deal, move on. If there is interest in it from the board, obviously this kind of technology is in extremely high demand currently. There are longer lead times. Generally speaking, what I'm talking about are either cameras or tablets that are all touchless, automated. It scans 10 people in a crowd at a time, takes their temperature. The tablets are on a stand that somebody walks up to, takes about 1 second. You can get a lot of people through. They're deployed in airports, they're deployed in casinos. I've been working with multiple vendors, learning and researching this kind of technology. I could pull the trigger on those things tomorrow morning. I have the proposals, I have the products. They're reasonably cost effective, especially the tablets. I can certainly work with Stella. It would still come in under the original technology numbers, the 260 that was thrown out 2-3 months ago.
Nathan, are you talking tens of thousands or hundreds of thousands?
Oh God, no. The tablets are 1,700, and the one camera is like 18,500. I don't I wouldn't foresee a lot of cameras. I mean, if there was interest and there is a desire to automate the temperature taking, these are tools that we could deploy reasonably quickly and would give another layer of peace of mind. It would not burden employees, and it would be another tool.
I'd be interested in the tablet as a trial. It sounds like it'd be automated. Might take the burden off our law enforcement as they're at the door of the security. The tablet would be interested. The cameras, I've seen those on the internet and on TV at the meatpacking plants, and so I assume they were expensive. But I'd be interested in the tablet to see if we can automate this process and help keep people more safe and more attentive to their normal security duties versus temperature checks.
How many tablets are we thinking, Nathan?
I wanted to get past the first blush of absolutely not, or yes, let's explore this. I mean, it would be reasonable to have one probably in the lobby past security, one probably by the employee back door, maybe one at West Campus. You just stick them on a podium. You need power. They're very simple devices. You stare at it for 1 second and it beeps, you're green. It beeps red. No, it can even tell you to put a mask on if you don't have one.
I'm interested in that.
Okay.
And we can reach out to Sunnycrest Conservation to see their interests, some of the libraries also. So we can put this on for Monday for another discussion item to have a little bit more information.
Nathan, Dave Baker, I have interest as well, but I would like to see a little more. I would like to see some detail, something in writing, and a little more. Where do we need them? What would the approximate cost be? And then we can make a decision, have discussion. But I think if you were looking for a hell no, I'm not hearing that. So I think
agreed.
Sounds like we have consensus at least to get some more information. And again, this is for the protection of our staff.
Understood. I will have something ready by the next meeting, and I'll probably send out some emails ahead of time for context and pictures and how they work.
Would that be for Monday's meeting, Nathan?
Yeah, I'm ready. I could do it tonight. I was ready to go. I've got everything ready, so I can get you more information. No big deal. I can get those emails sent out, and I can have something prepared for Monday for action if decided to.
Super.
For tonight's meeting, it's not on the agenda, and it's almost 9 o'clock, so we'll talk to you Monday.
Mr. Chairman, I apologize, but I have one final thing.
Go ahead, Denise.
I misspoke. The canvas would be on Monday, June 8th, not the 9th. And that is a regularly scheduled board meeting day.
Well, even better.
Luckily, I don't seem to be going very many places, so I have lots of time available.
Jenny texted me to let you know that I can't read a calendar.
Okay. All right. Thanks, Jenny. All right. We usually would try to work those in with another meeting. So, all right. Any other business? Otherwise, a motion to recess.
Chair Baker, we have so many people with us. I think I just would like to say thanks. We have so many of our staff with us here. I mean, I can't imagine what it's like to kind of lurch along and wonder if next week's going to be the time and what that means. So just thank you to everyone for your patience and for working extra hard. And I think we have great employees. We just have phenomenal employees.
I couldn't agree
Good
more.
to work with everyone.
I couldn't agree more.
Yep, I would echo that, and then also another extension on that. We've got great citizens and volunteers. That Board of Health, they're all doing it on their nickel. So they're all 100% volunteer, and I'm very thankful for the time and energy that they've put in all our boards and commissions. So we are very, very, very fortunate to have that type of involvement.
Agreed.
Okay, anything else? Dawn, is it adjournment or?
I will make a motion to recess till Monday.
Recess to Monday at 10 a.m. That's the motion. Is there a second?
There is a second.
Okay, all in favor signify by saying aye.
Aye.
Aye. Carried 3-0. Thank you all, and good night.
Good night, everyone.
Thank you.
Goodbye.
Yeah. This actually, I can't see.